views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hi, and welcome to Open BXRX Tuesday on BronxNet, a weekly program providing you the latest information, resources, services, and community efforts taking place locally here in the Bronx and virtually. I'm your host, Kibin, Alleyne, and today is Tuesday, November 30th, 2021. Coming up, it's been 40 years since the start of the AIDS and HIV epidemic. The disease has since become a manageable illness, however, disparities make this hard to achieve. Will race or gender impact how likely you are to be diagnosed? Then, the arrival of booster shots are now added to the vaccination lineup. A Montefiore health expert joins us for a discussion on these booster shots. Is someone still considered fully vaccinated without a booster? After that, in the South Bronx, several historic libraries are undergoing extensive renovations. What does support from Bronx elected officials mean to libraries in our borough? And Montefiore is celebrating 50 years of the postgraduate physician assistant surgical residency program. What are the elements an aspiring health professional will need for success in this program? So please stick around. Open BXRX Tuesday starts now. Welcome to Open BXRX Tuesday on BronxNet. I'm your host, Kibin, Alleyne, and I'd like to invite you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. Today, about 1.2 million people live with HIV in the United States. Once considered a death sentence, HIV can now be a manageable illness. However, disparities facing many communities who live with this virus make this hard to achieve. Dr. Oni Blackstock, HIV physician and founder of Health Justice, joins us for a discussion on inequalities within this sector of public health. Doctor, thank you so much for joining us.
Thanks so much for having me on.
So let's just jump right into it. I've noticed that sometimes HIV and AIDS are used interchangeably, but what is HIV and how does that differ from AIDS?
Right. So HIV stands for human immunodeficiency virus. So it's actually the virus that weakens the immune system. So the system within us that fights infections. So HIV targets the immune system and then leads people to get infections that they wouldn't ordinarily have, or cancers or other conditions. And so when HIV, the virus, weakens the immune system so much, usually when the level of T cells, which are one of the cells that fight infection, when those get below a certain number, we then will say that someone has AIDS, which stands for acquired immunodeficiency syndrome. And so that's when the virus, HIV, weakens the immune system so much that the body can't really protect itself against different infections and cancers.
So there are so many disparities in regards to HIV. However, an alarming disparity arises when it comes to contracting the virus. Despite prevention efforts, some groups of people are disproportionately affected by HIV. As a physician, what are some social determinants you see are linked to this disparity?
Right. So I think just like many other conditions, medical conditions, we see social determinants of health, and in particular, structural factors such as racism, sexism, homophobia, and transphobia, really impacting people's ability to access care, to go to appointments, to have insurance, to be employed. All of these things play a role in people being able to take care of their health. And so when we have these factors like racism, sexism, transphobia, those act as barriers to really people being able to take care of themselves, seek care, and that often places people at increased risk for HIV, or if they have HIV, can make it really difficult for them to be able to engage in care.
So, according to the CDC, in 2018, Black Americans accounted for 42% of new HIV diagnoses. For Latinos, it's 29%. We kind of talked about it briefly just now, but how does race impact how likely you are to be diagnosed with this virus?
Right. So I think we can choose. So there are a number of ways in which race or racism plays a role. But if we look at, for instance, health insurance, so health insurance is a major way that people are able to access health care for instance, for HIV testing so that they know their status, to be able to access HIV treatment, or to be able to access a pill called PrEP, which is a once a day pill that can be taken daily to prevent HIV. And so we know that in this country, for a number of reasons, because of occupational segregation that tends to concentrate Black and Latino people in jobs where they do not have benefits, such as health insurance, that then places them at an increased risk for being unable to access care if they need it, testing, prevention, or treatment. So that's one sort of pathway that places Black and Latino people at increased risk for either acquiring HIV, like not knowing their status, and then potentially spreading it to other individuals within their community. Because if someone doesn't know their status, then they can't always take measures to protect others.
Now, I think this is very shocking. The women in these communities are uniquely vulnerable. As the CDC reports, for African American, 92% of new HIV diagnoses were attributed to heterosexual contact, and it's 87% for Latino women. However, men in these same categories are seeing much, much lower numbers. How do we begin to address this disparity when we look within our own communities?
Yeah, so when we see Black and Latina women be impacted, and just to say for your audience, this is both for cisgender women, so women who people who identify as women and who are also assigned female sex at birth, as well as transgender women. So those are women who may have been assigned male sex at birth but identify currently as women. So Black and Latina cis and trans women are at increased risk for HIV, and this is because of the intersection of racism, sexism, and also transphobia. So, for instance, Black and Latina women may be at increased risk because, for instance, if mass incarceration, for instance, is targeting Black and Latino men, that takes a number of eligible partners out of the community. And so women may be more likely to have a partner who has other partners. And so when people are in relationships with people who are also in other relationships, that can also drive risk of HIV as well as sexually transmitted infections.
Wow, so it's kind of like just so many layers that goes into this. So thank you for explaining that because I was really shocked by that. Now, it's been decades since the start of what we known as the AIDS HIV epidemic, and you've mentioned in a Time article, given current trends, we're on track to end the epidemic among white Americans much sooner than we are among Black and Latino Americans. Can you elaborate on, why you said that?
Yeah, so it's really interesting. For instance, if you look at HIV data from New York City, for instance, you will see over time that an increasing proportion or fraction of new diagnoses are actually among Black and Latino people. So 80 to 90% of diagnoses in New York City are among Black and Latino people. This was not the case at the beginning of the HIV AIDS epidemic. There were inequities, but those have just gotten significantly more profound. And so there have been some studies done, we call them modeling studies, where they use math and different formulas to figure out, when will we see the end of the epidemic for different populations? And they looked at a number of different major cities in the United States and found that for Black and Latino Americans, it will take 10, 20, perhaps more years to end the epidemic among those groups than among white Americans.
So, upon my research, I also found that African Americans have low viral suppression rates. Can you just first explain what that is for some of us who don't know?
Sure. So the way that HIV treatment works, and the reason why it helps to maintain people's health and prolong their life, is because by taking it every day, it helps to suppress the virus or keep the virus at very low levels so it cannot copy or replicate itself. And so we sort of see one marker potentially of the success of HIV treatment is seeing when a patient is taking their medications that their viral load or the amount of virus they have in their blood is pushed to very, very low levels. And that can have positive impact for the individual, as well as if someone has an undetectable viral load where it cannot be detected detected by a test or a viral assay, what then happens, that person is actually at no risk of passing HIV on to their partners. However, we see that there are disparities or inequities across groups, with Black people and also Latino people having lower rates of viral suppression when they are taking their medications or when they have access to medication. And again, this is driven by some of the same barriers that I previously mentioned.
Now, what are some overall prevention challenges that, people in these groups are having?
Right. So what's really interesting is that when we look at the data, Black and Latino men, for instance, men who have sex with men, for instance, are a very highly impacted group. However, they are actually less likely to have risk behaviors, sexual behaviors, and drug use behaviors that we associate with HIV risk. The reason why Black and Latino men who have sex with men are at elevated risk is, again, because a number of factors that I mentioned earlier, including the fact that when people socialize and find partners, sexual partners, they tend to do so within their own communities. And so because of poverty, because of segregation has concentrated Black and Latino people in certain communities, and because of these other factors, such as lack of access to care, have led to people not knowing their status. For instance, Black and Latino men who have sex with men are at increased risk of HIV, even if they engage in what they think are protective behaviors, such as just having one partner. And so really the challenges are around, ensuring that people have access to HIV testing, that they have access to the PrEP pill that I mentioned, the once-a-day pill to prevent HIV. But the challenges are, if someone doesn't have access to a clinic, if they don't have health insurance, or they don't have a healthcare provider, that can make it more challenging for them to get access to testing and get access to the PrEP pill.
So the epidemic started, several decades ago, and it's been 3 decades since Magic Johnson revealed his HIV status to the world. And over the years, he's contributed to the education of this virus. Despite that, when we take a closer look, do you believe that the stigmas attached to HIV still heavily affect urban communities? And is there still a lack of overall education?
Mm-hmm. Yeah, so that's a great question. And I think it's, really inspiring for many people to see Magic Johnson, who, when he was diagnosed, came out, became an advocate around HIV. He talks about it less so now, but he's obviously lived a very long life and appears quite healthy. And it just shows sort of the impact and the power of HIV medications, or if someone has access to those. Nevertheless, we still see that HIV stigma remains an incredibly powerful barrier to testing, to people getting connected with HIV prevention as well as HIV treatment. We know that, for instance, Billy Porter from the show Pose, he only recently disclosed his HIV status, even though he's someone who's in the arts, where we know there are many people who, are living with HIV, and often they feel safe to share their status. He was playing a character who was living with HIV, and even still, he felt so stigmatized that he did not want to share his status. So HIV stigma remains a huge barrier that needs to be overcome in order to end the epidemic.
Doctor, thank you so much for joining us. Can you just tell us quickly, how can people stay in touch with you and learn more about the work that you're doing?
Sure. Thanks so much for having me. So you can follow me on Twitter at Oni_Blackstock, or also you can check out my website site, healthjustice.co. Thanks so much for having me on.
Thank you for joining us. We'll be right back with more Open BXRX Tuesday.
We know that people are dealing with the health crisis, but there's also a lot of food insecurity.
We're giving out healthy food options, and that's what's key here.
If you're a senior, you have a disability, they'll actually deliver meals to you.
The residents are anxious, they're worried, they're scared, they want to be tested.
When things were happening in our community and we couldn't get the help.
There's almost a presumption of criminality that attaches to your skin color.
The site will prioritize those who are at highest risk in the population.
If you feel symptoms and you'd like to visit one of these COVID-19 testing sites here in the Bronx, you may call the State Health Department's hotline.
Important to note about this site is no reservations are needed. This is a walk-in clinic.
A lot of us are out of work and looking for something to do.
We have the machinery and the skills to make large scales of these masks and gowns.
Take care of your people. It's going to go way further than we actually can understand.
Right now, employees like myself are just adjusting to the new reality.
Reporting from BronxNet, this is Carrasco.
We built a media network for you.
BronxNet TV.
Come learn in your new state-of-the-art studios at Lehman College.
At Mercy College.
And coming soon to the South Bronx in the Hub.
Inspire with your stories, culture, history.
Your Bronx on BronxNet.
Engage with us.
Connect with us at your channels and at BronxNet.tv.
Learn, engage, inspire. BronxNet TV.
From the Bronx
to the world.
BronxNet.
Welcome back. Vaccinations were made available to the public nearly a year ago, causing an uncertainty that was possibly greater than the COVID-19 virus itself. Now, the arrival of booster shots may cause an even larger divide between skeptics and public health professionals. Joining us to address concerns regarding booster shots is Assistant Professor for the Department of Medicine at Montefiore and Einstein, Dr. Inessa Gendlina. Doctor, thank you so much for joining us.
Thank you for having me. It's a pleasure.
So recently, the CDC recommended booster shots for millions of people who received the Moderna, Johnson & Johnson, and Pfizer vaccines. Can you just tell us what is the purpose of the booster shot?
Sure, that's a great question. So there's quite a bit of confusion between the third shot and the booster shot. So I'm going to actually take us back and say that we call somebody who's fully vaccinated is somebody who has received the initial fully prescribed series of vaccines. So it's the 2 mRNA vaccines for either Moderna or Pfizer and the 1 dose of J&J vaccine. So anything that comes after that initial series is extra. So for people who have pre-existing medical conditions who are immunocompromised, that third dose, what we call the third dose, comes about a month after completion of series. And then for people who are not needing that third dose, then additional dose is what we're calling a booster. So where is this idea of a booster coming from and when is it given? So the current recommendation is to get that booster dose or that additional extra dose that comes after the completion of the primary series at about 6 months or later after they are finished with their initial series of vaccines.
Now, you touched on it just slightly, but I like to look at it again. Who are the ideal patients that would qualify for third doses or booster shots?
Sure. So third dose specifically is for people who are immunocompromised, where there is a concern with being able to mount immunity to the initial series, with the idea that they need that third dose to be fully vaccinated and hopefully fully immune after that initial series. The booster is actually now available to everybody who is 18 years of age or older, so not our kids yet, but anybody who is 18 years of age and older. And CDC actually stratifies it a little bit into who should get a vaccine, that booster dose, who should get the booster dose, and who is eligible and may get that booster dose. So eligible and may get that booster dose is anybody who is 18 or older, and who really should get that dose are people who, again, are immunocompromised, above a certain age, above the age of 50, or people who are living or working in certain high-risk settings.
Now, many people took a huge step getting in line for the vaccine, and with recent mandates, thousands of people had no choice but to get vaccinated. Now, many people are apprehensive towards getting a third shot. What are your thoughts on this?
Yeah, and it's understandable. In general, people are apprehensive about getting any shot. I will say that Think about it the way we think about flu vaccine. So we get a flu vaccine every season, every year, because flu vaccine is seasonal. With COVID-19, as it has surprised us with everything it has done since the onset of COVID-19, it's not really coming seasonal, at least not yet, but it's coming in waves. So that's really the reason why we are encouraging and getting that booster dose or that sort of booster to the vaccination a little earlier, because the waves are coming more frequently. So there is apprehension, but if we think about it in a way of flu vaccines where we just get it every season because that's when the flu season comes, we just get it with the additional waves. So hopefully that should alleviate some anxiety and some apprehension if you think about it in a sense of, okay, this is the new wave that's starting and this is how we prepare for the new wave.
So now, how urgent is the need to receive a booster shot if you've already been vaccinated?
Yeah, so that's a great question. So urgency really gets at what is the risk of getting reinfected and what is one's remaining or what is one's immune status with respect to COVID-19. So with respect to risk, right? So if we're entering, as it appears, unfortunately, that we're entering yet another wave. So as the numbers start creeping up and unfortunately are expected to continue to go up, the risk of getting infected is becoming higher because there's more virus circulating. And that is combined with the fact that most of us have been vaccinated more than 6 months earlier, more than 6 months from our original series. And we know that the antibodies wane and the risk of getting symptomatic disease is becoming higher as we get further away from that initial series. That combined with the sort of uptick in numbers, I would encourage everybody who is eligible to get their booster as soon as possible.
Okay, so that kind of leads into my next question. How long is your COVID shot effective? And how do we just know this or can trust, like, okay, it's effective for this long?
Yeah, so effective is a complex question. So what does it mean for a COVID shot to be effective? So vaccine is doing exactly what it's supposed to be doing. It's protecting from severe disease, from hospitalizations, and from, God forbid, death related to COVID-19. So from that, vaccine remains probably as effective as it has been. The numbers that we're starting to see a little bit less in efficacy in having that symptomatic disease. So somebody who actually gets infected, is exposed to the virus, gets infected with the virus, is whether they're going to have symptoms and how symptomatic their disease is going to be. So that is what we're looking at, how long the vaccine is effective. And that's where we start seeing the vaccine efficacy starting to come down as the time goes on.
Now, is someone still considered fully vaccinated without a booster?
Yeah, so that's a great question. The answer is yes. The fully vaccinated definition remains the same from CDC. It's the completion of that primary series. And it actually makes a lot of sense from the clinical and scientific standpoint, because we know that that vaccine is still protecting against severe disease and having to be admitted to the hospital.
So right now, there aren't any mandates for a booster shot. So how should someone determine if getting the booster shot is right for them?
Yeah, so that's a great question. And that sort of gets back to their inherent risk and their time since their original vaccine series. So we know that 6 months out from their completion of the initial series, that the risk really starts to increase for symptomatic disease. And we know that the antibody levels really start to come down. So anybody who is approaching that 6 months or is at 6 months should definitely get their booster. And then combined with the fact that the overall numbers are starting to creep up. So anybody who maybe thought, oh, well, the numbers are low and maybe I can wait a little bit longer, now is the time.
So the addition of booster shots may have weakened faith in the original vaccine for some people and strengthened anti-vaxxers' refusal of the vaccine. How do you address patients who have a hard time trusting science and research as a health professional?
Yeah, so that's a tough question. And, I will say that it's at times a little bit difficult to address. We know that the vaccine does what it's supposed to do, and we know that our patients and we are incredibly well protected by the vaccine against severe disease, against being hospitalized, and obviously against poor outcomes. So, yes, we do need a booster to help us not have symptomatic disease and to decrease how well or how badly or how much of that virus is transmitted. We just have to keep explaining the science. And we know that there's a lot of anxiety because it's a new disease and it's a new vaccination. But from the both clinical, medical, and the basic science or biology standpoint, it actually really makes a lot of sense that we're going to need that third dose. And we get a third dose in a lot of other viral illnesses where you need that additional help a couple of months out to make sure that the immune system still remembers and knows what needs to be done. So it's still actually completely in alignment with what we understand about this virus.
Now, people who may have already have COVID face a very unique experience. It was commonly believed that if you already had COVID, that you didn't really need the vaccine, and some people went as far as to refusing to wear a mask outside. Where does those ideas stem from, and is there any validity to those statements?
Yeah, so what you're getting at is a question of natural immunity or immunity to having been fully infected with the virus. So this then gets at, well, how well are we protected if we have been infected in the past? So there's quite a bit of variability. So some people will mount a lot of antibody response and be very, very well protected. And some people will have very mild disease and not mount a really great antibody response. And we do know that those antibodies start to come down fairly rapidly and definitely much faster than they come down with people who have been vaccinated against COVID-19. So with all that, definitely still wear a mask if you had COVID in the past. Definitely don't want to be getting it again. Masks are a barrier. They are protecting from actually getting the virus in, whereas both natural immunity and vaccine-induced immunity, they protect against disease, but they have to see the virus first. So they're not a barrier like the masks are. And I definitely encourage vaccinating and then getting that booster dose 6 months out, because we know that the immunity after infection is not long lasting.
Now, I'm curious to know, would one booster shot work, or do you need to have those 2 prior shots?
Yeah, so booster shot is kind of like the part of in addition to the prior shot. So you need to have the original series for it to really be called a booster, because you have that pre-existing immunity from the initial vaccine itself. So the question whether that one booster shot is going to be sufficient or whether we're going to need more booster shots, that probably really remains to be seen and is really going to depend on how the pandemic really plays out and how we're going to keep seeing those. Are we going to keep seeing rolling peaks, or is it really going to become really like a influenza where it's going to be endemic maybe once a year, or a winter virus?
Okay, so this was really interesting, and I've definitely learned a lot just about booster shots and third shots and all of that. What services does Montefiore offer in regards to booster shots?
Sure. So Montefiore obviously has a very robust vaccination program, and that includes the primary vaccine series, and that includes the booster shots for Montefiore patients and Montefiore community.
All right, doctor, thank you so much for joining us.
Sure. Thank you for having me.
We'll be right back with more Open BXRX Tuesday. welcome back. New York City is home to over 80 New York public libraries, and in the South Bronx, several historic library branches are undergoing extensive renovations. These changes represent a significant investment in long term service for the community. Joining us for discussion on the impact libraries have in our borough of the Bronx and beyond is Interim Bronx Borough Director Kathleen Carrasco. Kathleen, thank you for joining us.
Thank you for having me on the show today.
So, as I mentioned, people in the Bronx will see some changes coming to their local libraries. Can you tell us about that?
Sure. So we're excited we have the Hunts Point and the Melrose branch in the South Bronx communities who are currently undergoing extensive renovations. So this also represents a significant investment by the library in the South Bronx communities. Mont Haven has been also undergoing renovations and will be reopening early next year. So the Melrose branch will be receiving a brand new third floor, which was lost a few years ago in a fire. Hunts Point branch will be repurposing a custodial apartment that it currently houses to hold a new HVAC system. So both branches will receive accessibility upgrades, including a fully accessible entrance at Melrose and a new ramp for the Hunts Point location. Also, in addition to that, a new elevator at both locations, designated reading areas for kids, teens, and adults, as well as community rooms for programming. So these upgrades to the HVAC, plumbing, and electrical systems, which also would be including new stairs, flooring, and lighting. So these will be beautiful spaces that the community will definitely be well able to enjoy.
And can you tell us, how did this initiative to transform these branches begin?
So this was a part back a few years ago of the city reinvesting and adding a 10-year capital plan for library branches. And then the library coming up with a plan as to also the improvement and the reinvestment and the passion that we need to get back into the communities to make sure that we have buildings that are equipped to continue to be these pillars in these communities, especially for our South Bronx branches that at that point, we do have locations that need a lot of improvement.
Now, I understand these changes received a lot of support from elected leaders like Councilmember Rafael Salamanca and Bronx Borough President Ruben Diaz Jr. What does support from local elected officials mean to libraries in the Bronx?
It's wonderful to have the support of the local elected officials, several including our Bronx Borough President, Ruben Diaz Jr., and our City Council Member Rafael Salamanca Jr. They also use the local libraries when they were kids and teens. So it clearly had made an impact on them because they have shown a lot of support throughout the years. And in order to keep the programming our patrons have come to expect, we need our elected officials to continue advocating for us to maintain the funding to keep these programs going.
That's wonderful. So the branches that are receiving upgrades are remembered as historic branches. Can you just tell us some of the legacies these libraries hold?
So the Melrose branch has been open to the public since 1914 and the Hunts Point since 1929. So Melrose has been a part of the community for over 100 years, and the Hunts Point has served their community for close to 100 years. So both branches have adapted to the needs of the patrons during that time. And as the residents change over time, we try to include books and programs that are of interest to them. But, we also offer back to school programming and tutoring for neighborhood kids. And then since the pandemic, we had to change our entire model and go online with virtual programming and classes so we can continue serving our patrons.
Now, I understand these branches will not only receive more space for community members, but like you mentioned previously, they will have building upgrades like a new HVAC system for heating and cooling the building. Can you explain why this was an important feature to add?
It was an absolutely vital feature to add, to definitely have functioning HVAC system in our spaces, not just for our patrons, but also for our staff. So during the summer months, a lot of our branches with operating HVAC systems are used as cooling centers where anyone, whether you have a library card or not, can just stop in to get out of the heat, and come in and read a book if they want to, use the computers. But it's also critical that our branches also are able to meet this need on a continuous basis. So, as winter is upon us, we want to make sure that the branches are also important just to be keeping warm as well. And with the branches getting back to indoor activities, including back to school programs and tutoring, a cold library, really distracts them from doing what they're there to do.
Okay, I think that's amazing. And when I learned that, I was like, oh, wow, that's like really important. And I'm really happy to
Yeah.
see that. So, as a society, we're talking more about inclusivity. So, I want to touch on the fact that these branch upgrades will include accessibility features. You kind of mentioned that a little bit before as well. Can you tell us more about that decision to just include people from all walks of life?
So part of this was definitely part of our Building for You campaign that we have launched several years ago, which incorporated recommendations from patrons, feedback from the community through a public survey, and also listening to our own, branch staff as well and leadership. And these recommendations certainly played a role in these decisions. So the library, in order to be truly open to everyone, we want to make sure that it's easy as possible for those with special needs to come in to our branches with ease and feasibility. Whether it's the ramps to enter to the branch or other improvements, we want to make our branches as accessible as possible to everyone.
So the renovations of the Melrose and Hunts Point branches are also part of historic funding for $100 million provided by the city to update and modernize these libraries. Can you explain the importance of investing in the New York Public Library?
I think just investing in libraries is ideal and very important. For many, the libraries are a refuge, or the libraries are that second place besides the home and the school where, you want to come to and congregate and use the resources. So patrons come to use our computers, take English as a second language class, to become U.S. citizens by, taking some of our study groups and some of our courses that we're able to offer. Also for after school tutoring, to check out books and for so much more. So patrons, just in functionality deserve, a wonderful building that they're able to come into and have functioning elevators, bathrooms, accessible ramps, heating and cooling systems, and of course, the most updates to the windows and computers. And modernizing our branches makes them that much more functional and able to serve our patrons a whole lot better.
Okay. And I love that you mentioned that it could be like a safe space for many children. I agree wholeheartedly. And I've seen it growing up. I grew up in the library as well. So I agree with that 100%. I wanted to further highlight this because the New York Public Library also offers a lot of free community oriented and enriching programs to low income communities. Can you tell us about any impact you've seen the New York Public Library have on these communities?
So right before the pandemic, we had our after school program, which was very vibrant, and especially in our South Bronx communities, which is that extension for the kids. And then one student, highlighted that he was able to pass his classes because he had the support, besides the school, in the library, and able to have the one-on-one support that, again, it was free. And a lot of times, tutoring support services, people have to pay for. So library funding helps us to increase those number of classes and programs we're able to host, whether that is the English as a second language classes, our resume building, job interview training, job fairs, and most recently, we're expanding into now the STEAM kits that we're able to give to the kids that maybe before weren't able to have access to them. So that's making a big difference in our communities. And the biggest thing out of all these programs, that they're free. Right? Or you could just come in. Hopefully people will sign up for a library card. That's our goal, to get as many people sign up for cards, so that way they can participate in the many of the programs that we offer for free, but also through our databases and that continuous online learning.
Now, one of the most impactful programs you offer is the summer reading program, now under the summer learning program. This was something that I grew up with, so I'm excited to highlight it for many. But for those who don't know, can you tell us more about this?
Sure. So this past summer, we rebranded and said, for our program will be summer learning. So part of this, it's giving away 60,000 kits to kids of all ages, from baby through high schoolers. And these kits flew off the shelves. There were tote bags filled with books, activities, Play-Doh, stress balls, and more in them. So the summer learning offered a wide range of activities to support families this summer, including our virtual summer camps, which was a 6-week program that included reading challenges and take-home activities. So the purpose of the summer learning program is just to help kids avoid what is called the summer slide, which kids often, don't retain what they learned during the school year and are playing catch up. So we wanted to incorporate like a lot of, fun educational activities so that it creates a fun learning experience for the kids.
Now, when can community members see and experience these new features that are coming to these branches?
So Monhaven will be hopefully reopening early next year. To our patrons for our Hunts Point and Melrose community, we're able to see these experiences for these new renovated branches in the summer of 2023.
And my next question, which is super important, what can people do to support or continue supporting their local libraries?
Visiting the local libraries, and anyone who's interested can also go to our website, www.nypl.org, where you can find more information about your local branches, programs, and those interested, and also in finding out more information of what the library has to offer.
All right, thank you so much. And I just want to add that the library does have a lot to offer. When you were mentioning the free programs, I also did my taxes at the library. And a lot of people don't know that, they help you with all of these things. So definitely super important to just get involved with your local library. Kathleen, thank you so much for joining us. We really appreciate it.
Thank you so much for having me.
We'll be right back with more Open BXRX Tuesday.
If you're struggling to afford your internet bills during the pandemic, there's a temporary government program that may be able to help. It's called the Emergency Broadband Benefit, and it provides up to $50 monthly discount on your broadband bill to qualifying households. Find more information about the program, including if you qualify and how to enroll, at fcc.gov/broadbandbenefit, or call toll-free at 833-511-0311. That's 833-511-0311.
Welcome back. Montefiore is celebrating 50 years of the Postgraduate Physician Assistant Surgical Residency Program. Here to discuss the residency program is Chief PA and Program Director, Ben Phillip. Ben, thank you so much for joining us.
Thank you for having me.
So Montefiore's Physician Assistant Residency is the oldest postgraduate residency program in the country. I think that's pretty amazing. Can you tell us more about the program?
Sure. So this all started in around 1970, where the chairman and vice chair of that time, Dr. Rich Rosen and Dr. Marvin Gleedman, had a vision to have providers that would be mainstays for the surgical services that they were in charge of. As you know, surgical residencies, they have residents going through rotations 4 to 6 weeks at a time, and there was really no mainstay in those surgical services. So they had a vision to have providers to be the backbone of the surgery services. And so their efforts took them to Duke University in 1970, which was the first PA program in the country. And they recruited 4 PAs to take back with them to the Bronx and started training in 1971. And their vision was to have them alongside the MD surgical residents. So it started out as a 4-year program, and they quickly realized, hit a bit of a kink, with regards to the length of the program. After 4 years, they realized that these PAs developed into junior surgeons, and so that was a little bit of a problem. So the program length turned from 4 years to 2 years, and now, as it is, 14 months. And the goal of our program is for our PAs to achieve the highest level of surgical proficiency in such a concentrated time frame.
So, for someone who probably doesn't know, what role does a physician assistant take on in the medical world?
Great question. So it's equivalent to being a first or second year MD surgical resident. And what that means is they're pretty much the point person of that surgical team. They learn how to take care of patients on a day-to-day basis, involved in coordination of care, interdisciplinary team rounds that involve social work, case managers, and other services involved in the surgical patient's care. They manage surgically critically ill patients and be able to provide compassionate, effective care to this diverse group of people. They also first assist in surgical procedures, which involves positioning, exposure, hemostasis, and ultimately anticipating the needs and the steps of the surgeon that they're operating with. And they're also involved in research.
Oh, okay, thank you. So, what are some of the areas this program focuses on?
Yeah, so we start out with a 2-month. We start in September every year, and we start out with a 2-month didactic period. Following the didactic period, we have clinical rotations, 10 rotations, and so they're comprised of 2 months of general surgery, 2 months of vascular surgery. There is a trauma and surgical ICU component where they rotate through Jacobi Medical Center, which is a level 1 trauma center. They're involved with minimally invasive surgery rotation, where that's mostly bariatric surgery, like weight loss surgery. They have an ambulatory surgery rotation, which is located at the Hutch campus in the Bronx. And that's your bread and butter general surgery, hernias, gallbladders, and same-day surgeries. And also they have transplant surgeries. They're involved with kidney transplants, liver transplants, and going on procurements to different institutions. And they also have 2 elective rotations where they can choose any surgical specialty of their choice.
Oh, okay, and I'd like to know, do they, well, you just said of their choice. I was gonna say, like, do they get a choice to, like, pick which field that they're most interested in?
Yeah, they can repeat a rotation that they loved, or something that really isn't on our mandatory rotations. Like plastic surgery, cardiothoracic surgery, something that piqued their interest during their time here. So.
Okay, interesting. So, how does it feel to be part of a program that has reached such a huge milestone, considering many hospitals face so many challenges during the pandemic?
It's a tremendous achievement, and to understand that achievement, you have to understand that postgraduate training in itself for physician assistants is totally optional, right? They graduated from PA school, and from PA school they can go work in a job making 6 figures, or they can go for further training, such as our program, a residency program, training program, making half that amount, but for the sake of being specialized in surgery or ER or critical care. In Montefiore, we have the surgery program, and they it's an intense program, but gratifying that they are proficient in taking care of surgical patients. That being said, you know, that is a huge hurdle. But that being said, we've had over 450 graduates from our program, and COVID, as everyone knows, was indeed challenging. You know, earlier in the pandemic, when elective surgeries were postponed or deferred, PA students, while they were on their surgical rotations, did not really have the ideal surgical rotation, and so that that made our program, our residency program at Montefiore, quite ideal for these patients, for these PAs that really wanted to pursue a career in surgery. And so, case in point is our incoming class of 2021. We had about 48 applicants for only 6 spots, and so a lot of people had to be on the waiting list, and it was a good problem, but you know, it was challenging, definitely.
Right. Good problems to have.
Yes.
So, according to the website, in this program, you will obtain 3 elements: knowledge, judgment, and technique. Can you tell me more about that and the commitment to train reliable PAs?
Yes. So knowledge of surgery. Like I said before, September we start every year, and we start out with the didactic. And the purpose of the didactic is to, um, you know, start the training of surgical knowledge. And we achieve that through um, various faculty and staff PAs that provide talks on surgical diseases and topics that they will encounter in their clinical rotations at Montefiore. We have hands-on labs for suturing and laparoscopic skills at our minimally invasive surgery lab at Montefiore. And we have simulation labs to place special lines, catheters, and training in our EMR, which is Epic. And November onwards, when they are in their surgical rotations, they attend educational conferences as they go, to get that knowledge aspect. The technique, we preach the art of first assisting, which is suturing, positioning the patient, exposure, hemostasis. They, you know, at a given time during their training, the PA's residents will assist about 20 to 30 surgeons, attending surgeons. And so they have, which, you know, they have their basic approach, but they also have their variation of technique and certain instruments that they use and things like that. And now the PA residents, after going through this, they'll have that in their arsenal as they pursue a career in surgery to refer back to. So in a given year, they assist in about 150 cases per resident, and that's plenty of experience to achieve and fine tune their technique. Judgment is knowledge and technique. It combines knowledge and the technique they attain. It comes by experience. You know, judgment we mean by how to decide on on managing a patient's condition. You know, deciding on what technique to use in the OR, and ultimately deciding if a patient needs a surgical procedure or not. So these 3 elements are our 3 pillars of this program.
Now, how can those that are eligible for this apply? And, you know, what are the steps? What are the steps and some advice you'd had for people who are interested?
So the first thing is they need to be accredited. They need to graduate from an accredited PA program, and we accept applications as early as December. That can be found on our website. It's an application and also a personal statement on what made you become or wanting to become a surgical PA. And you know, we have mandatory references and transcripts that they would need to send. And we usually interview in February, March, and give decisions out in April.
Now, where can people go to learn more?
We actually have a Montefiore website. I think that'll be posted shortly, and you can have you. There's a brief blurb of our residency program, and as well as contact information, as well as our application is all on that website.
And then lastly, what is, I guess, a quick piece of advice you have for these aspiring students?
If you're interested in surgery, just be a sponge. Be a sponge while in PA school. Live, breathe, and eat surgery. Know why you want to go into surgery. It's not just for the money, but also taking care of these critically ill patients, and especially in the Bronx. The diversity of patients that we see, as well as the complex issues that they have, make it challenging. But it takes a uh, certain type of person who's willing to go through such a rigorous and intense training program like Montefiore, to be the exceptional and fully trained surgical PA that you can be.
All right, Ben, thank you so much for joining us.
Oh, no problem. Pleasure's mine.
That's all for our show today. Thanks for tuning in. I'm Kibin, wishing you and yours safety and wellness now and always. See you next time.